this is her scan from April. Ideally, it would be nice to have a scan from a little bit sooner, but within the year, I think is fine. And unfortunately, this is a non-con because she's allergic to contrast. But you know, if there is contrast, you can look for patency of the IVC, patency of the iliac veins. But even on this non-con, I kind of get the feeling that the IVC is patent. It doesn't look like there's any stenosis, any scarring. And then the other things I'm looking for, I want to see how straight the filter is. And this filter looks really straight. I like windowing it so you can see the struts really nicely. And this has a hook, you can see right there. And the hook looks like it's straight. It looks like it's not sort of endothelialized against the wall of the IVC. Other things I'm looking for, you want to see if there's any fractures of the struts. And I want to see what the struts are doing. You know, you've seen a million CTs. A lot of times these legs and struts are extending past the wall of the IVC. That doesn't really bother me. The IVC is such a forgiving vessel that usually that's fine. And then, you know, there was some questions about whether these legs and struts are involving the aorta. Very, very hard to tell. Again, that doesn't really bother me. They're so tiny that I usually, you know, I feel pretty comfortable pulling them if they're just kind of along the wall of the aorta.
So even if there's like minimal damage to like the like adventitia or whatever the aorta, it wouldn't matter because it's so small.
Right, and we've held her anticoagulation for 48 hours, so you know, usually they do okay. And that's pretty much it. And then, you know, this the other thing as we talked about is I do like having a covered stent in the room. Very rare to have to use it, but you just want to have an idea of the measurement of the cava. So I think I measured this at about 2022. And then you want to have an idea of where the renal veins lie, because if you do have to place a covered stent, you don't want to cover the renal veins. And then that's pretty much it. Any questions or?
No, I mean, not much really.
Okay.
It was pretty straightforward.
Okay.
Everything made sense.
Good.
Yeah.
Awesome.
I mean, even if we didn't have, like you said, like this is a non-con, like we still shoot the venogram before we start anyways, so that helps.
Yeah. I wouldn't delay this patient's care because but it is important, especially filters that are this old. You got to have some sort of cross-sectional imaging. I don't think an X-ray is sufficient.
So if there were broken struts,
at least you have an idea of what you're getting into.
Okay.
I wouldn't necessarily stop. I wouldn't not do the case if there were broken struts, but at least you have an idea of, you know, what you may need, if you'll need forceps to go after the pieces.
That makes sense.
Yeah. And it's also a discussion with the patient, right?
Yeah.
Like if there's fractures, they may end up in your pulmonary arteries, and it's a very real discussion that they need to know about.
And if they do end up like embolizing, I mean, they're just so tiny that are there any like major long-term risks?
If it dislodges sort of distal in the pulmonary arterial system, probably nothing. You just obviously you'd be concerned if it's more central, but then you can try and go after it. You can try and snare it. Great, awesome. Well, good job. Thank you. All right. So I always get a single shot of the actual filter. Make sure that nothing's broken. None of the struts are broken. It didn't look like on CT, but things do change after a few months. Okay. And then I like to get at least one oblique. Good. And then the other thing I like to do is just get a scout of the chest before I start, because if something breaks during the procedure, at least we have a baseline to see if there was anything there to start. Great. Doesn't look like there's anything. Okay. All right. Right. Hey. So as we talked about, I just like to have my sheath in the groin, you know, just in case there is an IVC rupture or anything. At least we have.
5 or 6 French.
So I'm just gonna go to 12 because that's what the
Okay.
balloon
That's what the
goes
balloon
through.
requires.
Yeah.
I got 8 and 10 down, and it just came with the.
Sharp down. Sharp down.
Jen, do you mind just moving the screen sort of towards us?
Yeah.
Thank you so much.
Yeah, and then we'll help.
Amazing.
Sharp
Thank
down,
you.
Nadim.
Sharp down.
Okay. Gonna wire. Okay. Good. Good. Yeah, just dial it up a little bit.
Do you want the 10 or just go straight for the 12?
Just go straight to the 12, I think. Okay. You wanna load it on? Erica, can I get a flush, please? Oh, thank you. Good. Okay. All right, Erica, can I get some contrast? So I'll just shoot the right iliac here. That way we can just clear the right side, and then we only have to do our pigtail run from the left. Can I get 20 cc of contrast? 50-50 is fine. Looks good. Okay. All right. So we just got to remember to keep flushing this, Nadim. Now let's get our IJ access.
Ray, can I get a burn thing? What? Can I get a burn, spin?
Do we have an exchange advantage too?
Yep.
Or did you flush this?
Yeah. Let me read
Sharp coming back. Can I get the scalpel? Thank you.
That's essentially the same for like a transregular, right?
What do you mean? Like how we actually?
Size-wise, like
It's probably even a little bigger. All right, Erica, let's start with a 6 French sheath here. And we'll, do we have an advantage?
Yeah, I got a Benson too if you needed a shorter wire.
Sure, Benson's fine. Actually, no, we'll go the advantage. I think. Yeah. And then once we get our 6 in, we'll we'll flip the table.
Yeah, sorry,
let me know when you want me to fluoro.
Yeah, go ahead and fluoro. Okay, can I see down a little bit, Erica? Thanks, sir. Okay, can pause down. Okay. Good. Can you save that, Erica? Okay. All right, do we have that 6 sheath?
Yeah, one moment, please.
Can I get flush? Thank you. Can I get a little contrast? Go ahead, pull, Nadine. Thank you.
20 or 10?
10's fine. So Nadim, I always give it a little just test puff before we do a power injection. Okay, good. Looks like we're in a good spot. All right, Ray, let's hook up here. Okay. Let's go forward. Let's come back. Okay, let's go forward. Let's go 15 for 30, please. Yeah. Erica, so can we raise the table a little bit and mag out? Okay. Let's see where we are. All right, could I just see up a little bit? Just basically put the pigtail at the bottom of the screen. Keep going, Erica. Yep, that's good. And can you just center the filter a little bit? Yeah, that's good. Let me see the pig. Yep, perfect. All right, good. Can we just, Eric, can you just see the, yeah, open the shutter. Yeah, perfect. We good over there? Okay, let's come back. Great, let's go forward. Good. All right, so it may be hard to step out of here, Nadine, but I'll protect you. All right, you want to do 15 for 30, Ray? All right. Hit it. Good. Off. Great. This looks open. You know, good flow. No, we're good. We're good.
Nice little pelvic collateral.
Yeah. Yeah.
Flush that.
Anytime you see that little, you almost get the sense that there's a little flattening of the left common iliac and a little indent. That could be an element of May Thurner. She has no symptoms though that would be consistent with May Thurner.
I can flush it.
So okay. All right, great. So let's get our advantage. All right. Can we get the advantage? All right.
Yeah.
And then, do we have that 18 sheath open? Okay. All right, Nadine, you want to pin pull this guy off? Yep. Good. Okay. Okay. All right, we got that sheath ready? Okay. And then, Erica, once I'm putting the sheath in, if we could just pan up to the chest. Sorry, sheath coming off. Nadine.
Oh.
Ready for the going to the chest now?
Yeah, please.
No, I'm gonna flip the pin. Ready?
Yep. Okay, a little more. Great. That's fine. So you really want to watch this under fluoro. It's a big sheath. Okay. Even that kind of bend of the wire I don't love. All right, let me see down, Erica. Okay. So basically I bring the dilator to the level of the filter hook, and then I kind of peel off the sheath. Okay. You just want to leave a couple centimeters of running room. Okay. Erica, can you save that? Okay, great. So now we can take the inner and the wire out. And then Erica, could I get the sauce? We have the snare open. You can open the snare. And then we have exchange glide. And then Erica, whenever you get a chance, if you could just kind of mag up on the filter. So Nadine, we're going to use this sauce.
Yep.
Basically get into the filter, and then we'll put our glide wire through that, and then we'll try and snare out the wire. That make sense?
Yes, that makes sense. Thanks.
Yeah, that's fine. Now, you can use different types of wires. People use 014 wires. I like using the glide wire, exchange glide wire. Okay. All right, can you pull that wire back for me? You got the... Erica, could you mag up for me? Ray, if there's any way to move the monitor a little closer to me. All right, so you're gonna go past the filter, then pull the wire so I can get that, natural curve. And it just kind of. Sometimes it helps just pulling the sheath of the catheter up.
Yeah.
All right. So sorry. The important thing is here, you want to be sort of through the middle of the filter, right? You want equidistant on both sides, the equal amount of struts on both sides. You don't want to have just like two struts. So Erica, could we oblique this? A little bit more if you can. Hard to tell, but I think it's okay. And then, can you go the other oblique?
One moment, please.
Yep. What's that, Ray? Okay. Yep, that's fine, I think. Okay.
Give you the Andy view.
All right, so there's my,
You want me to come closer to pin it?
all right. Yeah, so if you could hold this.
This guy?
So basically what we're trying to do is we're trying to feed that glide wire through the, through my snare. Okay,
So do you want me to pull
so, yeah. Go ahead and pull back, and we're just trying to get it in there. Okay, let's do that. You can pull this out now.
Okay.
It was
the
easy.
pigtail and the
The sauce and the wire, yep. Yep. Okay. Good, okay. So this is gonna have to come out now. I just wanna get a feel for this. Okay. Okay. All right. All right, great. So can we get the laser ready? Oh, right, awesome. That's 16 French, perfect. Did it make sense what we were trying to do?
Yeah,
Okay.
yeah, 100%.
Yeah, it's
seeing it is like a lot.
it's very difficult with one person. You really need two pairs of hands. Like that.
Watch out for your snare there.
Yep. Okay, can I go ahead?
You're going to bring it close to the edge as possible. Right to this, and go straight right down here.
And you put it in calibrate and he'll come on the pedal.
Are you on calibrate?
We're going to be on calibrate right now.
Okay. Calibrating. Okay.
You got a fault.
Yeah, the fault there.
Okay. There you go. Let me back up a little bit. We're going to come in a little straighter onto it.
Okay.
There you go. Try again. And your calibration's okay. I'm
Great.
going to put you in standby.
Okay.
And then Ray, what you want to do is once he gets it in the patient.
All right. So do we want to give it a flush? Okay. Okay. Great. Okay. All right. So I think we can just go ahead and put it in right now, and then we'll put the. All right. So when we pull the filter, can I get a 20 cc of contrast ready, and just have the advantage? You got the advantage. So I take a quick picture from the groin, make sure there's no obvious tear, and then we can do our formal venogram. Okay. Okay, can we have that snare, please?
I'm reloading it. Give me 1 second. I have that question.
Yep, good. Okay. So Nadeem, I may need your help with fluoro while I'm pressing
Yep,
the
absolutely.
pedal. So you want to get really up to the hook, right?
Yep, exactly. Because it could slip off.
Yep. Good. All right, so first I'm just going to kind of advance my 18 sheath over it. Just kind of see how it feels. Okay. All right, can you go ahead and fluoro for me?
Yep.
All right, so laser's ready. Okay. Okay, so I kind of pull on it, all right? And then I'm advancing both down as a system. Can you fluoro save that for me?
I sure can.
Boss moves.
Oop. Erica, can you hold on to that for me? Great. All right. Can I get a wire?
You need Advantage or,
Yeah, Advantage is fine.
okay.
Yep. See, you get a lot of bleed back from this. But you can see it's just it just sort of carves out a path along the side of the filter. Okay. Just pull the wire back in for me.
It's in enough sunlight to pull up. Yeah.
Can you pull the wire back for me?
Oh, well, it wasn't.
All right, so I'll pull the sheath back a little bit. All right, Ray, can we hook up for another run here? All right, let's flush. Okay, yep. All right, go ahead, go forward. Okay, let's come back.
Right, say it with your chest. So is the song.
Great, let's go forward. Same thing, 15 for 30. All right. Whenever you're ready, Ray. Yep. Hit it. Great. All right, off. That's good, Ray. That's good. You know, no obvious tear. You can maybe hallucinate a little spasm
Irregularity
there,
or something, yeah.
but you know, nothing to do. Ray, can we put this on native? Yes, sir. I'll just put on native just to make sure I'm not missing anything. See the inflow from the renal veins. Great. Great.
Nice.
All right, I think we're done. All right, so we'll just hold some pressure. I can hold pressure.
Okay, I'll do the now.
Yeah, she
Awesome.
can resume her anticoagulation this evening.
Okay.
That's fine.